moving on quickly to our last segment, which I know you love a good Florida surgery mishap.
Yeah, tell me what they messed up on.
So, this one, there's not a lot to it, which is good. We're kind of slow on time, or kind of low on time here. So this is actually a story out of Miami, Florida, about a patient who got what kind of surgery, Sarah?
A BBL.
She got a BBL.
Yes.
In 2021. You guys know how I feel about BBL. It's the second time I've said this in this episode today. I don't like BBLs, high mortality rate, long-term issues. We can talk about that some other time. So this Dr. Julio Alvarez, who I looked up, the guy's totally legit, board certified plastic surgeon. He did have some previous state complaints, but seemed like not really a whole lot there as far as I could find. So there's a new complaint filed against this guy from the Florida Department of Health against him regarding this patient from 2021. And the reason I picked this is because the story makes no sense.
Okay.
I read the story and I was like, this makes zero sense, so obviously we need to talk about it. So the patient was said to have a BBL. After discharge, the patient had to go to the hospital for severe abdominal pain. I was like, okay, that's interesting. I mean, Brazilian butt lift is just liposuction and fat injection. I mean, there is that risk of dying, but normally when people die, and we've talked about people that have had that happen, they kind of, just kind of lose consciousness, or they just kind of like have a cardiovascular collapse. So this patient actually had severe abdominal pain. So that's a different type of complication spectrum than we're used to seeing. And so they go to the hospital and come to find out the patient had a drain placed intra-abdominally. Okay, so that's the weird part. So first off, you don't use drains in a BBL. So there has to be more to this story for why was there a drain placed in this patient. And I think that there's an obvious answer for this. And the obvious answer is probably they had a tummy tuck with a BBL.
Okay.
We hear about that all the time. We've talked about many patients who had tummy tuck BBLs and had complications. And so you do use drains for tummy tucks. Now, it still doesn't make sense to me because, and maybe it's best, Charles, if you throw up that last infographic. So this is your abdominal wall. So you see those green circles that I placed on the image? They're kind of right above the white and red structures.
Yeah.
Okay, so that is the tissue plane dissection for a abdominoplasty. You go through the skin, you go through the fat. So the skin's the black line, the subcutaneous tissue is the fat layer. And when you get down to that fascial layer, which is where those little zeros are, then you start to go along the top of it, okay? You never go deeper than that. Look at all those layers between the circle and the X, because the X is where the drain ended up.
Oh.
Yeah, like how in the world? How did this happen? He went through 3 layers of fascia, 3 layers of muscle, or 1 giant layer of muscle, plus a posterior layer of fascial and the peritoneum. Like, I don't understand it. The story just mystifies me. I have to assume that the patient had abdominoplasty. That's not what the story said. The story said it was a straight up BBL, which is just, that would be even more incredulous. But yeah, so this patient apparently had to go into emergency surgery to have this drain removed, and now they're like doing this investigation about it. And
But she's okay?
Yeah, she made it.
Okay, good.
Yeah, she's fine. Yeah, she didn't die. It was just a severe abdominal pain.
Good.
And I guess maybe one of the reasons that they're looking into this might be because of just the very odd finding of a drain intra-abdominally. And I really want to know more about this because that layer that you're talking about, I mean, it's hard to get through it with a knife when you're just cutting straight through it. I just don't understand how a drain got into that spot.
He didn't have the right playlist.
Maybe he didn't. Maybe he saw an owl. I don't know.
An owl. He stepped on a bug.
He had a fight with his wife.
Yeah.
I don't know. I mean, I'm gonna give the guy the benefit of the doubt that he didn't do something crazy. I mean, things can happen in surgery. Okay, so let me say one example where this could potentially happen, and it would be believable if the patient had a bunch of liposuction in the past, which is also along that plane where those circles are.
Okay.
And the guy got into like horrible scar tissue. I just had a tummy tuck I did the other day, and man, the patient had previous liposuction, and it sucked big time because that tissue plane that I like to go through, very easily, was just concrete. And it took me a long time to get through because you don't want to go too deep, right? But the thing is, if you go too deep, generally you hit muscle and okay, I've gone too deep. So I still don't know how that would happen, but yeah, that's an odd one. Like going all the way into the abdominal cavity with a drain, I call it a mishap. It's like a misdirection.
That's a bad mistake.
Yeah, fortunately the patient's okay, and maybe there'll be more information about it. And like I said, I'm not dogging this, guys.
Probably.
Things happen in surgery, and I mean, it's one of those things where anything can happen, and maybe this was just a really hard case, but I just found it weird. That's just, everything about the story made no sense, and so I just want to touch base, and I really probably should have like another plastic surgeon on here that could pontificate with me.
Maybe.
I should have called somebody.
Maybe.
So Sarah, you have to stand
Dial in.
You're standing, you in trouble. Trey, any thoughts?
I have no pontification.
No pontification. That's all right. Sometimes we just like to talk about things and say, hey, this happened, and hey, we'll follow up on it and see what comes of it.
100%.
All right, I think that is all the time we have for today. I want to thank you guys so much for tuning in. We really, really do appreciate it. Please leave us a comment. We would love to talk about some topics that you'd like to hear about on the next episode of Nip Talk.